I'd like to discuss a little bit about the form and shape of what we call integrative oncology. As we know, oncology means the field of medicine that works with people with cancer. The word integrative means bringing together different things. So when you integrate in the United States, there's big movements since the 50s and 60s we integrated schools. We integrated that. We were bringing people of color with people of Caucasians and bringing them together. So integrating is bringing things together. So integrative oncology is bringing together what? Bringing together all the different modalities for healing, the healing modalities. And there are many. We've got the traditional ones, which are Ayurvedic medicine, traditional Chinese medicine, botanical medicine of Europe and the United States, Native American medicine, homeopathic medicine. So there's all those aspects of the healing modalities. And then there's more modern ones like chiropractics, osteopathy, and then of course allopathy, which is empty. Every one of those has its place in healing human beings. And so the art, the finesse, is to find the best of each of those and bring them together into an integrative approach. And that's basically what integrative oncology is. So we use herbs, we use acupuncture, we use cleansing, different types of cleansing, different kinds of energy work. And we use interventional IVs of high doses of vitamin C and other botanically derived substances, in addition to working on the mind and body connection. Because the mind, body, and the spirit are really one thing. We separate them just so we can talk about them. But I mean, you get into an automobile accident, what happens? You hurt your body? Mm-hmm. Yeah. Anything else happen? Mm-hmm. Were you emotionally affected? Absolutely. Psychologically affected? Spiritually affected? Yeah. All those things happen. You can't separate them. They're not separable. Okay? So, and that's how life is. Our life happens on all these levels at once. So we have to deal with that. So we have to deal with our ability to, we have to clear the mind. Just like you do a colonic or enema to clean out your bowels, you need to do a mind enema. You need to clean out the fears and clean out the madness and stuff like that. So part of cleansing is all of that. So anyway, there's a lot involved. And basically, we're talking about dealing with the whole person and not just the toe or some other singular aspect of it, because that would be missing the entire. That's the old proverbial blind person holding the tail of the elephant and trying to tell you what an elephant looks like, and another person is holding its front leg, and another person is holding the trunk, and another person is touching its abdomen, the ears. Okay? These are aspects of a whole, and they're not going to give you any idea of what the whole is. So that's what integrative oncology is. It's bringing it all together. And if you haven't brought it all together, if you're just using one or two or three methods, then it doesn't really qualify as integrative oncology.